Hi, today we're going to talk about how to floss under the bridge. If you've been following me, you know I'm a big believer in flossing, and I push as much as I can. I floss anywhere I go. I've done it in stadiums, 100,000 people. I've done it in concerts. I've done it, you name it, I've done it because I want you not to be shy of flossing, because when you got that junk in your mouth, you better take care of it or it's going to eat your tooth away. Well, let's talk about bridge first. When we're missing a tooth, in order to fill that gap, you have a few options. One is to do partial. It's something that you put in and take out. But as far as fixed options, something that you don't have to put in and take out, you have only two options. One is to do an implant that goes right into the bone. And then option two is a bridge. You're bridging this middle area between one and two teeth, one in the front, one in the back. So by doing that, you gain another tooth in the middle without doing any surgery, such as implant. Now, when you do that, you cannot floss between those teeth just like you do between your other teeth. Why? Because it's all connected. When it's all one unit together, you cannot run the floss straight down. Now, why is it important to floss? Well, food and bacteria can get trapped right underneath these, and if it gets trapped there, it will start growing and cause decay. That's the most common area under the bridge that patients can get cavity. In order to prevent that, you have to floss. Floss is your best friend, right? All right, let's talk about how to floss under a bridge. This is specifically for those of you who have bridge, okay? Let's go. This is a bridge. What is a bridge? First of all, it's a connection of two teeth with a missing tooth in the middle. So it looks something like this, and it's always bonded in. Now, how do you floss under this? Because it's almost impossible. When you grab a piece of floss, you can easily floss in front of that tooth. You can floss, or bridge, I should say. You can floss here easily. You can floss here easily. But right in the bridge, you cannot floss. This does not go in. Well, what are we going to do? There are a couple options. You can get these floss threaders. They have a pointy, harder end. And in order to use that, you get just your regular floss, you pass it through here, and you put a knot in there so it will not come out. Then after you do that, you can pass it through either front or back under the bridge. And then when you pull it out, you want to floss on the sides of this up and down in order to get it cleaned up, because this surface is the most common surface patients get cavity, and also the surface on the other side, that's another surface that's super common for patients to get cavity. Now sometimes the bridge has opening that's a little bit more open. You don't have to use this tiny floss. You can actually use these little bristles, and you can purchase these again at Walmart or Walgreens or Target, any store, and you can actually pass it through. In here is pretty tight. If you notice, I cannot pass this through. It blocks it. So this is not a good option if it's pretty tight contact and you cannot get it through, okay? If it's tight like this, you need something something smaller and more kind of rigid at the end so you can pass that through the area.